Hi, I am Dr. Lindsey Heim. I am a dentist here at Madison Family Dental, and just here to talk a little bit about what we can offer for pediatric dental services. So typically we do want to see children around 12 to 18 months of age for their first dental checkup, and even though we don't do a cleaning at that age, it's still really important to screen the teeth. We're oftentimes looking for little weak areas in the enamel. We're also screening for any sort of habits that may, negatively influence a child's health, and also other health issues that can influence a child's dental health. The other things that we can screen for are any sort of bite abnormalities that may become an issue down the road, or also be involved in a lot of airway issues as far as how a child's sort of mouth and jaws are developing. So a lot of times with this first visit, we'll sort of show the kids sort of what we're using. We'll show them a little mirror, sort of practice opening up wide, and get a little look at their teeth, and sort of screen for things. And if we feel like we need to, come up with a little plan as far as preventative measures that a child would benefit from, we can do that at an early age. And a lot of times we can be fairly conservative with things that we can do or tweak little habits that can make a big difference down the road, especially because even though baby teeth, we don't need them for a lifetime typically, it is really important to keep them healthy for a number of reasons, sort of more than just eating, because they do a lot from a structural standpoint too. So a lot of times I have parents ask, what they can do to help prepare their child for their first dental visit. And so a few little things that you can do. I mean, one, there's some great books out there, sort of about your child's first visit to the dentist, what to expect at the dentist, what we're here for. And we're here to make sure that, we have really nice healthy teeth so we can do all the things that we want to do with our teeth, like eating and talking and all of that. You can sort of talk to your child about what to expect, practice opening up really wide. If they have a favorite animal, you can sometimes pretend to be that animal, like open up big like a T-Rex or, whatever that animal might be. So that can sometimes help out a child just sort of know what to do and know what to expect as they go into their first dental visit. So as kids get older, typically we'll do early childhood exams from about 12 to 18 months until a child is about 3 years old. After that, we'll start with regular cleanings, usually at a 6-month interval, give or take, depending upon a child's individual needs. And here we really try to make things as positive as possible and make sure that kids are having a good experience. We have some really sort of great things like a kids club that reinforces really great, behavior with kids and sort of gives them little goals to work for. And we really try to tailor our care to where a child is at. For some kids, they like to know what's going on, and we can show them, what are we doing? What are we sort of working in their mouth with, and things like that. We have some little stuffed animals that a lot of times kids will love to hold on to, or sort of show what we do with those. So a lot of things that we can do, as a child gets older, to make sure that coming to the dentist is as positive as we can possibly make it. So by seeing children regularly and starting at an early age, we can follow their growth and a lot of times catch problems as early as we can, so we can address things as conservatively and as early as possible. After all, teeth, they aren't just sort of part of the mouth, they're for a whole child's well-being.